today we're going to present Nursing in Politics by Shayal and Haley Graham. So how does nursing become political? So nurses rely strongly on government policies and systems to protect patient and workplace safety. So some ways nursing become political are due to the following reasons: staff and patient ratios. So in hospital settings, we see if it's like a non-trauma unit, it's like usually 1 to 4 nurse to staff patient ratios. And secondly, pay. Due to less pay, most of the nurses tend to move out to like places where they are paid more. Thirdly, patients' right advocacy, advocating for patient-centered care where safety is important. Advocacy to improve healthcare in local communities, highlighting public health initiatives with local cities, basically like during voting seasons, being present there, voting for like propositions to have safe healthcare for patients and also for nurses. Nursing advocacy organizations. Some of the major nursing advocacy groups in California and US are American Nursing Association, California Nurses Association, National Nurses United, SEIU Nurse Alliance of California, American Public Health Association. So these groups like basically advocate for nurses and proper health care in hospitals and local communities. Also kind of bring safe working environment for nurses.
So where do we see the impacts of politics on nursing? A lot of the work that people do today was actually influenced by politics. So we have a few examples, but for instance, a lot of social services impacts around nursing, such as maternal, child, and adolescent health, advocacy around certain groups that are often a lot more vulnerable. Racial health equity, so American Public Health Association recently declared racial health equity as a public health crisis. And so really highlighting these components in political organizations helps actually drive some funding opportunities and a lot more opportunities for local, state, and federal governments to be able to support ideas or new innovative ways of approaching a lot of health outcome disparities that we see in our more vulnerable populations. Additionally, impacts on nursing that we've seen is kind of the expansion of the Affordable Care Act, so ACA, and then when Medicare and Medicaid were initially implemented. So when both of those initiatives were implemented within the United States as a whole, nurses actually saw an increase in responsibilities because a lot of times people were actually able to access care that they weren't previously able to access. And so those allowed lifting some of those barriers, the financial barriers that patients were incurring. And so a lot of nursing staff ended up seeing an uptick in their responsibilities and tasks and activities just due to the fact that there was an expansion of availability of healthcare. Additionally, more recently during the COVID-19 pandemic, I think we saw a lot of politics and policies implemented or as a result of what happened during COVID-19, more safety precautions implemented on organizational levels and again in local, state, and federal levels as well. And so things such as like equal pay, making sure that people were getting paid overtime when they were working overtime during the pandemic, making sure people had access to proper PPE and making sure that they were safe at work while patients were also being kept safe. And so prioritizing those two concepts, I think a lot of that was highlighted during the pandemic that we saw. And so we see the impact today on an organizational level, especially of some of those policies that are implemented in different hospitals or different healthcare facilities. And so the benefit to all of being in nursing in politics is you actually see a really large workforce. So about 20% of the healthcare workforce is nursing, and so there's a lot of power in those numbers. And so if there is an issue that is happening, you can actually community organize and get nurses together to advocate on behalf of addressing some of those issues. We actually recently saw this with the Kaiser Permanente strikes that were happening down south. So advocating for equal pay, but also patient advocacy in their own rights as well. And so in numbers, they were able to kind of make an impact and really voice their concerns about safety that was happening within their workplace, and that is how they were able to kind of influence a lot of their change. And so there's so many ways you can get involved. So if you're looking to really trying to work with other people and advocate on a more systematic level, you can do so on an organizational level. So you can do so within your own healthcare facility that you work at. You can do it on your local, state, and federal level as well. So simply getting out there and voting is a lot of times a lot of help, but also just basic patient advocacy. And so if you are interested, that's kind of a great place to start.
Just to conclude, as future nurses, we do have a critical role and obligation to be involved, be present. Like Haley mentioned, like the Kaiser nurses, they walked out due to safety concern, better healthcare quality for their patients, and also advocating for better pay for the nurses. So as we will all be future nurses, it is our right to advocate and have proper healthcare equalities for everyone, for safety for the nurses, and also proper care for our patients. Thank you.